All right, let's dive right into one of the most high-pressure situations you can imagine in medicine, a cardiovascular emergency. I mean, we're talking about a scenario where every single second counts, and a single decision can literally mean the difference between life and death. So, I want you to picture this. The scene is pure chaos, right? There's this incredible sense of urgency. A patient's heart is in crisis. The doctors, they need answers, and they need them, like, yesterday. The big question is, how do you even begin to look inside a beating heart when it's under that much stress, right there at the bedside? It's a massive challenge. But the answer? Well, it's a total game changer. First things first, let's really get a handle on the stakes here. You know, this isn't your average checkup, not even close. We're talking about the absolute most severe, life-threatening heart problems a person can have. Yeah, these are the situations where the heart is just failing, catastrophically. Think about cardiogenic shock. That's when the heart just can't pump enough blood to keep the body going, or a massive pulmonary embolism, a huge clot blocking blood flow to the lungs. In those moments, doctors are basically flying blind. Without a clear, immediate picture of what's going on, they're just guessing. And that's exactly why having a real-time window into the heart becomes so unbelievably critical.
Okay, so how do you get that window? How do you peek inside? Well, the answer is a piece of tech that's been getting smaller, faster, and way more powerful over the years. And it all comes down to the power of sound.
And here it is, cardiac ultrasound, or CUS for short. Now, the three words that make this thing a total game changer are rapid, non-invasive, and bedside. Just think about that. This isn't some giant, clunky machine you have to wheel a patient to down the hall. Nope. This is a tool that comes right to the patient, giving doctors a live, moving picture of the heart, all without making a single cut. So the advantage of CUS really boils down to this simple, powerful three-step process. You start with a super fast assessment right there at the bedside. That speed lets you get to a much more accurate diagnosis. And with that diagnosis, you can guide the treatment with incredible precision. It basically takes the guesswork out of the equation and replaces it with a targeted plan of action at the exact moment it matters most. But, having an amazing tool is really only half the story. It's like giving a bunch of people super fast cars without any traffic laws. For it to be truly effective for everyone, you need to make sure everyone's using it the same way, holding it to the same high standard. Basically, you need a rule book. And that's exactly what just happened. This isn't just some casual suggestion either. This is a huge clinical consensus coming from 3 of Europe's absolute top cardiovascular associations. We're talking the best of the best in imaging, acute care, and intensive care. They all came together to create one unified document that lays out the best practices for using cardiac ultrasound when things get serious.
So you might be thinking, okay, hold on. If the technology is so awesome, why did they suddenly need a new rulebook? And that's a great question. The thing is, as this tech got more and more popular, some pretty critical gaps started showing up in how people were actually using it.
Before this new consensus, you really have 3 big problems. First, the training was all over the place. Second, the quality of the ultrasounds themselves was super inconsistent. And third, you had all these brilliant specialists, cardiologists, intensive care docs, kind of working in their own little bubbles. So this new rulebook tackles all of that head on. It recommends clear training pathways, it sets solid standards for quality and competence, and it pushes everyone to work together. It's really all about creating one single high standard of care for every patient, every time. So what does this all add up to? The tech, the new rules, what does it mean for the actual person in that hospital bed? Well, it means a huge shift, a fundamental shift toward care that is not just smarter, but so much safer. And really, this quote from the document itself just says it all perfectly. The ultimate goal, it's simple, but it's also incredibly profound, to optimize patient outcomes. It's about making sure cardiac ultrasound isn't just seen as some cool gadget, but as a fundamental cornerstone of how we do emergency medicine. So how does it actually do that? Well, by setting up one high-quality standard for everyone, it immediately improves how accurate the diagnoses are. It also helps doctors figure out who's at the highest risk, a process called risk stratification. And having clear guidelines just makes things safer all around, for patients and for the doctors. It's a total win-win. Look, this is a huge step forward for the emergencies happening right now, today. But what's really cool is that the people who wrote this document, they're already looking ahead, over the horizon at what's coming next.
Because let's be real, technology never, ever stands still. So this whole consensus isn't just about getting the present right, it's also about getting ready for the future and for the incredible new tools that are just around the corner. So what does that future even look like? Well, just imagine this. Artificial intelligence that helps doctors read those ultrasound images in real time, or using big data to spot patterns that a human eye could easily miss. Think about connected tech that would let an expert, sitting hundreds of miles away, guide a doctor through a procedure. I mean, this is the next wave, and it's going to make this amazing tool even more powerful.
And that really brings us to the big takeaway here. Because this whole story, it's about more than just ultrasound, right? It's about how we as a society adopt to powerful new technologies in medicine. As we get these clearer, more detailed windows into how our own bodies work, the real challenge will always be building the rules, the standards, to make sure those tools are used safely, effectively, and for the benefit of every single patient. It makes you wonder, what new standards will we need next?